good day to all. This video presentation is about first aid. It talks about what are the things that we can do to our surrounding or the people that are in need for immediate care. The videos that are shown in this complication are the things that you may use and should acknowledge or learn to be aware for basic first aid to help the people in need for immediate first aid care.
Sometimes, the occasional graze or paper cuts might happen when you least expect it. But what is the proper way to treat them? Let's find out. Step 1. Stop the bleeding. Use some gauze and apply direct pressure to the wound. Step 2. Wash it. Wash the wound under running water. Step 3. Clean it. Use an antiseptic cleaning solution to clean the wound. Step 4. Dress it up. Use a cotton bud and apply a thin layer of antiseptic cream over the wound, followed by covering it with either a plaster or some gauze and tape. Clean and dress the wound every day to make sure that it stays clean and uninfected.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 mg, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become more responsive,
when a baby or child has a burn, cooling it under cold running water will reduce pain, swelling, and the risk of scarring. The faster and longer a burn is cooled, the smaller the impact of the injury.
if you've done a primary survey and established that your casualty is unresponsive but breathing normally, they should be placed into the recovery position to help maintain the airway. To do this, kneel next to them on the floor. Remove their glasses and any bulky objects in their pockets, but do not search their pockets for small items. Make sure both of the casualty's legs are straight. Then take the arm nearest to you and place it at a right angle to the body with the palm facing upwards, like so. Take the other arm and bend across their chest and place the back of their hand against their cheek nearest to you and hold it there. With your other hand, lift their far knee up until their foot is flat on the floor. Whilst keeping the casualty's hand pressed against their cheek, pull on the far leg and carefully roll the casualty towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the area remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking the level of response until help arrives. So remember, if the casualty stops breathing at any time, call 999 or 112 and prepare to give them CPR. And that's how you place someone in the recovery position. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.